Hi everybody, my name is Aaron Herrick and I am the marketing specialist here at Palmetto Project as well as a licensed insurance agent, and I am excited to introduce our Marketplace 101 video series. So for those of you that keep up with our social media and saw our Medicaid 101 video series, where we broke down all the different parts of Medicaid, enrollment, application, everything, it'll be very akin to that, but this time we are going to be reviewing the Affordable Care Act Marketplace. So before we go into the open enrollment period, the enrollment process, and all the documentation you will need, I think it is first important to discuss specific insurance terms that you need to know to understand your coverage in general. So understanding your ACA coverage involves an understanding of certain insurance terms, and the first term that I'd like to discuss is premium. So a premium is a monthly payment that you give to the insurance company to make sure that your policy is still in place. Think of this as your gym membership each month to make sure your insurance is still covering you. So the next term that I'd like to introduce is deductible. And so the deductible is basically the amount that you are responsible for before the insurance company kicks in. So for example, if you had a $250 drug deductible, that means that you would be responsible for $250 worth of your medication before the insurance would start assisting with that. Next is coinsurance, and coinsurance typically kicks in after you've met the deductible. And what coinsurance is a percentage amount established that you will pay and the insurance company will pay. So for example, if you had a coinsurance rate of 20%, that means that you would be responsible for 20% of the covered services, while the insurance company would cover the remaining 80%. In addition to coinsurance, copay, which can be a little bit confusing, is a set rate that you pay for services. Usually this will be associated with things like primary care visits, specialist visits, or medication. So the last term that I'd like to discuss is maximum out-of-pocket, or MOOP. And your maximum out-of-pocket, as the name implies, is the utmost amount that you would pay towards your healthcare. So say catastrophe befalls you and you end up in the hospital and you are just using your coverage left and right. That means that if you had a maximum out-of-pocket of $7,000 is the absolute most that you would pay for services. This typically includes things like your deductible, your coinsurance and copays, but does not include your premium payment each month. So now that I've discussed the different key terms that are important to marketplace coverage and insurance coverage in general, I'm now going to discuss how Palmetto Project can help you with your marketplace coverage. So not only can we help you explore your options, help you find savings that you didn't know you were eligible for, and compile plans, but we can even help you find other coverage if marketplace just isn't in the cards right now. If you're interested in discussing this with an agent or would just like to explore your options, please feel free to reach out to us at 843-577-4122 or visit insuresc.org for more information. With that out of the way, make sure you tune in next week where we discuss the Marketplace open enrollment period.